Okay, everybody, we're going to get started on this weekly segment called What About Weight Loss? My name is Cheri Stoka, and I am owner of Weight Loss MD, and I thought it was very important to really just offer a forum where people could ask questions about weight loss because there's so many different aspects to weight loss, and at Weight Loss MD, we focus a lot on gut health and more of those foundational issues as it relates to, whole body and overall weight loss. So I thought today we would talk about gut health. So I put some questions out there to people because this is a forum where you can actually submit a question in advance, or you can join in and we can have dialogue live. So it really is up to you. So that's kind of what we're going to do today. We're going to talk about gut health. I posed the question of asking people if they have gut symptoms, constipation, bloating, diarrhea, skin issues. A lot of these symptoms people don't realize are a result of gut imbalances. So we're gonna really dig into that today. All right. So I did receive a number of really great questions that really kind of didn't really get me thinking, but really warranted more, investigation on how I was going to articulate this. But I'll maybe start with the easier ones first. And one of the questions that came through was, I've been told to cut out gluten, sugar, and dairy, but can't commit to all three. Where should I start? So that is a great question. That is a very good question. So my suggestion for that person would be gluten has to be the first thing to go. There is a lot of research out there that shows that gluten really can be, how I explain it to people is it can be a grenade to the gut lining. And when you are constantly injuring the gut, you will never get to a place where your body can start to heal. So gluten, if you know for sure, I mean, the majority of people have issues with gluten and just kind of either don't know it or they just ignore it. But if you know for sure that you are one of those that is very reactive to it, you need to eliminate it like immediately. So the other two that you mentioned, dairy and sugar. Dairy, actually, the protein in dairy, which is casein, so it's casein in whey. So casein is actually recognized by the body similar to gluten. So we are always telling people to get off of dairy if they have a gluten intolerance or a gluten allergy. But dairy just in itself causes a lot of its own issues. And so if you are, if you're starting out and you're eliminating dairy and you're still including, you're eliminating gluten and you're still including dairy, I would recommend taking a enzyme, lactase, that's going to help digest dairy, because what people don't really realize is that the majority of people are walking around with no enzymes that actually break the enzymes needed to break down dairy. And I tell people, often that, cow's milk was made for cows. That's why humans don't have those enzymes, cows do. So that is what I would recommend for the person in getting started. The next question is, what does it mean if I am constipated one day and have diarrhea the other days? So if you are someone, and this is very common, we see this, we ask a lot of very specific symptom questions when people come to see us, even though, our focus is weight loss, we're all about foundational health, because you can't get someone to maintain, optimal weight loss if there's, so many underlying issues going on. So we're big into gut health, probably 40% of the practice is really just working with people on improving their gut health. So to answer that question, constipation and diarrhea, right away, I know that there's some gut imbalances that are going on. Now, it can become, it can be a little more complicated, but I will just highlight some potential reasons why someone could be experiencing this. Number one is, you could be told that you have IBS. So that, I mean, that is another segment in itself, because that IBS is irritable bowel syndrome. So if you go in to see your doctor and they tell you, they diagnose you with IBS because you have constipation and diarrhea and it's intermittent, that's really just a way for them to say, well, you have an issue, but we're not really sure what's wrong. So essentially they're going to wait till maybe you progress more into that IBD, which is inflammatory bowel disease. Not saying that IBS is going to result in that, but IBS is kind of one of those conditions where they really don't know what to do, because in conventional medicine, they don't do testing that is necessary to uncover what is actually causing it. Everything has a cause. So you have to figure out like what it is. So some of the main things could be some underlying infection. We do very comprehensive testing. We see people that have gut infections all the time. It could be parasites. It could be H. pylori. It could be a candida overgrowth, which is a fungus overgrowth. So that could be causing that. SIBO, which is small intestinal bacterial overgrowth. So that's a condition where bacteria that is really the majority resides in the colon starts to migrate up into the small intestine and causes a lot of symptoms, a lot of constipation and diarrhea. So that could be one of the reasons. People that are exposed to mold, so toxic mold exposure, people that have, some people know that they have been, living in mold for a long period of time. I will tell you that if this is you and you are listening, don't think that's going to go away on its own. You have to be aggressive and strategic, and you have to remove it from your body, because I'm telling you, it's going to cause a whole host of issues, if you let it go for long periods of time. So those are some of the main things. One thing I will just say is, you need to find out what's causing it, because again, 9 times out of 10, this is not going to resolve on its own. So let's see. The next question, does the gut play a role in depression? What a great question. So the gut is the foundation to the human body. It is like the roots of a tree. If the gut is not in a healthy, balanced state, every system in the body will be affected. And if you look into the research, and if you look at all of these chronic diseases and chronic illnesses that we are seeing in this day and age, it is all tied back to the foundation, which is the gut. So as it relates to depression, absolutely 100%, there is a correlation to the gut. So there is the gut-brain axis, and the gut and the brain are constantly communicating with one another. So the health of one is going to affect the health of the other, and obviously vice versa. So if you are someone who struggles from depression, absolutely looking foundationally at what is going on, what else is going on. Newer research is even showing, now it's like, hello, like this is not, this has been around for so long, and people have known that the gut plays such a role. And now, people are starting to better understand how it affects so many disease states. But now we know that it's one of, well, I hate to say it's like one of the main reasons for Alzheimer's, but there's a huge correlation with people with Alzheimer's as well. So to answer that question, absolutely, there is a correlation. So you want to, again, this is all, I'm not saying that the gut is the only reason, but it's the foundation. So if you can start to heal the foundation, it's a ripple effect. Then you start to see hormones balance, you start to see blood sugars balance, you start to see this brain axis start to heal. So you fix the foundation and you see things start to heal on its own, because that's essentially what the body wants to do. It wants to heal. So you have to give it the substrate. You have to give it the ability to do what it's meant to do. Okay, so let's see. We have another question, which is a great question. Could I have gut issues without having any of these symptoms? So when we sent out a newsletter, we kind of like listed a number of symptoms. So it was diarrhea, constipation, acne, brain fog. There were a number of symptoms. So some people that are reading that are thinking, okay, I don't think I have gut issues because I don't have any of those symptoms. So it's very important to understand that that was just a list of like maybe some common symptoms that are related to gut issues. But like I had just mentioned, the gut is the foundation and affects almost every system in the body. So I think it's important to maybe take a step back and write down your symptoms. And that way you can better be prepared with having a conversation with a practitioner or some people like us who are very well versed in the gut and say, these are the symptoms that I'm experiencing. Could that be related to gut issues? And at Weight Loss MD, we send out a very comprehensive system assessment survey to all of our patients before they come in, because we want to know if we're dealing with just a weight loss patient or if we're dealing with major imbalances and foundational issues in the human body that we have to address before we can really get this person to lose weight, not only lose weight, but keep it off long term. Okay. So the other question, which is a great question here, I'm just pulling up some of these that are being emailed. It has to do with okay, here we go. How are eczema and acne related to the gut? All right, so we have some major vital organs in our body, and our vital organs would include the brain, the liver, the bladder, stomach, lungs, and the skin. The skin is actually the largest organ in the human body, and it has its own set of bacteria, this ecosystem, the ecosystem that lives in our digestive tract, which is trillions and trillions of organisms. The same applies to our skin. There is an ecosystem, there's bacteria, and with that comes immune cells, so the skin is largely affected by the gut, because if the gut is unhealthy, it's going to affect that vital organ, just like it affects the liver, just like it affects our lungs, our brain. So it's absolutely no different. And it's hard for people to kind of comprehend that it has anything to do with our skin, because we can't see the things that are going on with our internal organs, but we can surely see what's going on with our external organ, which is our skin. And when you think about autoimmune disease, which again is rampant, it's rampant. And that is largely a gut issue, because the majority of the immune system, the immune cells, sit in the gut. So, chronic acne can be an autoimmune disorder, because it essentially is your disrupted, imbalanced gut and disrupted immune system that's now attacking its own organs. So now the skin is that for you, it's the skin is the problem. So it is one of the first things that I am thinking about when I see people that really struggle from this chronic acne. And you often can even tell the different type of acne. So some people have larger type of cystic acne. Some people have like smaller, and that is really driven by the type of infection that you have going on. So candida overgrowth can cause acne. There are other specific kind of overgrowth that can cause specific issues with the skin, but just know that there's definitely a connection. You always want to go to the gut if you have this chronic acne. Do not go to the medications that are out there, because those are so damaging, long-term to the human body. And just to give you an example of, the bacteria and the things that actually live and reside in our skin is, if most people, if you're younger and you go to the doctor and you have acne, sometimes you're being put on an antibiotic because they know it's a bacterial imbalance. They just don't know how to treat it. So it's definitely related, and really kind of, regaining that balance in your gut is night and day. And the last thing I'll say about that is dairy. Dairy is like such a culprit for acne, and we have seen it over and over and over again. When you remove dairy from the diet, the skin clears up. So I think that might be our last question. Let me see here. Okay, so there is a question, is bloating normal? Okay, so I think every single person on the planet experiences bloating, at some point. So I would ask the question, how often? Do you know the specific foods that's causing, this symptom? So it's a little more complex. It can be normal and be very just benign, but 9.9 times out of 10, it's due to some underlying condition. Unfortunately, we live in this modern world where we're attacked. Our guts are being beaten down every single day from the food that we eat, from the air that we breathe, the water that we drink, the candles and the air fresheners and the fragrances and stuff we put on our skin. Listen, it's usually the cause of something. So that's why we dig into foundational underlying conditions, because you have to give your body a chance to heal, and you have to give your body a chance to repair and regenerate. And so that is where we come in, Weight Loss MD and Wellness. Obviously we are a weight loss business because that is priority for a lot of people. But once you start to dig deeper into how we can get you to a good, healthy state, that's kind of the path we go. So I am just going to take one quick last look to see if there's any last questions. And that is it for today. So hopefully we will have more people sign on for next week, and we will definitely push out some, really interesting